As we have discussed a few times over the last couple of weeks, after many weeks of moving in the right direction in terms of cases, hospitalizations, and so forth, we are now seeing a sustained increase in cases. And today is obviously July the 1st, and I will tell you that over the second half of June, we lost all of the progress that we made in the month of June in terms of hospitalizations. And in terms of the number of cases, in several regions, they're actually back to the highest point that they've ever been. As a result, Louisiana is back squarely on the radar of the White House Coronavirus Task Force. Yesterday, I had a long conversation with Dr. Birx, going over the recent trends that we've seen here in Louisiana. And by the way, they match very much what's going on in other parts of the country as well. But her big concern is the increase in positivity that we're seeing across the state of Louisiana. And you all know the challenge with that. We've increased testing. We're going to talk more about that later. And so you would expect to have more cases with the increased testing. But if the positivity, if the percentage of tests that you're giving resulting in a positive case, if that's going up, then what that means is you actually have more COVID-19 than you did before. And that certainly is the case here in Louisiana. And it was that increasing positivity in our state, and principally here in the Baton Rouge area, which is why Dr. Birx called me yesterday. So in short, the situation isn't as rosy as we would like it to be, and there's a big concern about the number of cases, that positivity we talked about, and the increased number of individuals in our hospitals with COVID-19. As I just mentioned, East Baton Rouge Parish, after great progress over the last several weeks, is also becoming a hot spot again. It was specifically the positivity in this region that caused Dr. Birx to give me a call. And we discussed a plan that we will pursue together, the White House Coronavirus Task Force, the Health and Human Services, and also the Office of the Public Health Service at the federal level, working with GOSEP and the National Guard. We're on a course that by Tuesday we hope to have a number of testing sites open here in Baton Rouge to test an additional 5,000 people per day, just in the Baton Rouge area, to try to help us get on top of this particular situation. And to further highlight just the degree of concern that they have around the country, it's my understanding this is one of 3 such efforts being undertaken anywhere in the country. Again, this effort we believe will start on Tuesday. A lot of work to do between now and then. I don't believe we can set it up and on Tuesday actually have 5,000 individuals tested, but we will get to that number in short order. I also know that Mayor Broome, earlier today, I believe, has announced a mask mandate for East Baton Rouge Parish. I want you to know that I appreciate that decision on her part. I support it. I also support similar mask mandates that have been put in place in Orleans Parish and in Jefferson Parish from Mayor Latoya Cantrell and Parish President Cynthia Lee Shang. I would also tell you that in a communication, I think it was dated June the 29th, I saw it yesterday, the White House specifically called out East Baton Rouge Parish as a place where a mask mandate, because of the positivity principally going up, is where a mask mandate should be seriously considered. And the Vice President on the call with us on Monday, a video telephone conference, indicated the White House's support for these measures being taken locally. So I just wanted to offer my support for those mandates as well. I am not today announcing additional restrictions for Louisiana. You will recall that when I announced that we would pause in phase 2 because of the fact that we did not meet the gating criteria to proceed to phase 3, that we would do a deep dive on the data in 2 weeks. We're not quite there yet. I can tell you we're looking at the data every single day, and certainly it's not improving. I just went through that. But we are going to do everything that we can to get more compliance with the restrictions we currently have in place as we are in phase 2, but also get more compliance with the mitigation measures by the general public, things that everybody can do. Remember, everybody has a role to play, and there are things that everybody can do. Principally, they involve wearing a mask when you're outside of your home and you are not interacting solely with members of your immediate household. They involve washing your hands frequently, staying home when you're sick, and maintaining physical distancing when you are out and about. We are going to increase enforcement because we don't want to go back to reducing occupancy if we can avoid it. We don't want to close more businesses and so forth if we can avoid it. But we also don't want a few bad actors, people who are just not honoring the restrictions that are in place in order to we don't want them to prevent us from continuing to move forward. So we're going to be more robust in our enforcement. We are encouraging every business, every venue to do everything that they can to comply with the restrictions that are in place. And I'm also I'm urging the general public, don't patronize businesses that are not conducting themselves in a safe manner and in accordance with the restrictions that are in place. If you must, remember, you're safer at home than you are anywhere else, but if you're going to go out and patronize businesses, patronize those that are interested in your safety. And when you do so, do it in a way that shows you're interested in the safety of your neighbor, which is why you should wear a mask. We continue to see significant increases in cases and hospitalizations across the state. Today, we are reporting 2,083 new cases. You heard me right, 2,083. Now, that's on 23,577 tests. 23,000 tests being reported today. Now, it is true that about 900 of the cases being reported today were backlogged from one commercial lab out of state, but they're not really that old. The oldest positive test result dates back to June the 16th. And so there were about 900 of those, and they're dated somewhere between June the 16th and June the 29th. And so those are very much relevant for the current conversation. But even if for some reason you want to exclude those 900, that's an awful lot of new COVID cases that we're reporting today. We haven't reported more than 2,000 cases in a day since April. Obviously, we should all be concerned. Sadly, we are reporting 17 new deaths for a total of 3,130 thus far. We have 799 patients in the hospital today with COVID-19. That is the highest it's been since May the 27th, when it was 798. That's why I'm telling you, we've given up all the gains that we've made in June, and our trajectory suggests that we're going to give more ground up, and which is why we have to do a better job with the restrictions and the mitigation measures. On a regional level, hospitalizations per capita are increasing in Orleans, Greater Baton Rouge, Acadiana, Southwest, Central Louisiana, Shreveport, Bossier, and the Monroe areas. That's 7 of our 9 regions. In terms of case growth, only 3 of the 9 regions show a slight downward trajectory, and that's really over 3 days. And so 3 days doesn't really make for a trend, but that's in Southwest Louisiana, Central Louisiana, and up in the Northeast Louisiana area around Monroe. Our statewide positive rate continues to inch higher. As of June 26, we're looking at a 9.7% positivity rate for new tests. But there are several regions that are above 10, and you may remember that 10 is the standard that's been set forth by the World Health Organization and the CDC is that barometer where you know that you're where you need to be. On testing, there is a bit of good news in light of the overall effort. You may remember that we announced some time back that the testing goal we had per month that we had worked out with our federal partners in terms of the resourcing and so forth, that we would test 200,000 individuals per month. This month, or I should say in June, we actually tested 385,000 people. That is almost twice our goal, and anyway, it's a good thing because cases are there. Testing doesn't produce a case, it just lets you know where you have them. And if you don't know where you have them, then it's impossible to devise the strategies and put forth the effort necessary to communicate with those individuals, to get them into isolation, and to minimize the spread from those positive cases that you have. And again, yeah, we are testing more, but the case growth is outpacing our testing as evidenced by that increased positivity. We know that the vast majority of our recent case growth is coming from the spread of the virus in communities. And in fact, I will tell you 98% of today's cases come from the community. Only 2% come from congregate settings. With respect to young people, as we have previously noted, there's been a huge increase in case growth among 18 to 29-year-olds. And within that demographic, the cases are especially arising among 18 to 25-year-olds. And you can look at the graph there and see just how pronounced that rise is. And here we are in Baton Rouge, where we have Southern University and LSU and BRCC and so forth. And like college towns all over the country, we are really seeing, not just across the state, which is true, but particularly here in Baton Rouge, a really steep increase in cases with young people in that 18 to 25-year-old range. We do know that age plays a role. We know that your personal COVID risk increases with age, but people, including young people with chronic conditions, whether that's diabetes, obesity, heart disease, lung disease, kidney disease, whatever, they're all at higher risk for serious outcomes from COVID-19. The latest CDC analysis shows that people with these conditions are 6 times more likely to be hospitalized and 12 times more likely to die from the virus. We also know that many people, including young people, don't yet know they have an underlying chronic health condition that makes them more vulnerable to this particular disease, not to mention the fact that we've also seen generally healthy people really struggle with the virus. But regardless, young people with COVID, young people with COVID are contagious, and we need them to be more mindful of their own health, but also we need them to be good neighbors and be mindful of the risk that they pose to others through spreading, especially those who are vulnerable. With respect to nursing homes, a brief update. On June the 17th, as you all know, LDH sent a letter to all nursing homes in the state stating they needed to complete baseline testing of all of their residents and staff by June 30th. I'm pleased to report baseline testing is complete. All the nursing homes participated. We did have a few residents who refused to be tested, and I think perhaps maybe a few staff as well, but the baseline test was complete.